You're watching Talk with Audrey. Welcome back. Millions of people in the U.S. live with eye conditions that can cause blindness if left untreated. One of the most common causes of vision loss later in life is age-related macular degeneration and wet AMD, an advanced form that can cause severe and rapid vision loss, but it can be stopped or slowed if caught early enough. My guest today is Dr. Talia Kaden. She's an ophthalmologist at Manhattan Eye, Ear, and Throat Hospital, and she joins me now with some tips to help you prioritize your eye health. We're also going to talk about some of the treatments for wet AMD, including the newest options available to patients. Welcome.
Thank you so much for having me.
Well, I've heard a lot about age-related macular degeneration, but what's the difference between AMD and wet AMD?
Sure. So as you mentioned, age-related macular degeneration is a very common disease. It impacts over 20 million Americans. And of those 20 million, about 1.5 million have what's known as wet macular degeneration. So what that means is that, the retina is the back of the eye. It's the part of the eye that allows us to see it. We always describe it as the film in the camera. And the macula is the central part of the retina. It's the part that allows you to see really fine details and allows you to read. And when we have wet macular degeneration, there are abnormal blood vessels that can form in the macula. And these abnormal blood vessels can leak and they can bleed and they can cause permanent vision loss.
So it's sort of like a film over what you see, or does it also distort your vision?
So that's a great question. In terms of the symptoms, they can be pretty broad. So it can be things like just general blurry vision. It can be difficulty driving or watching TV. Or it can be that straight lines start to look wavy. So if you're looking at the tile in your bathroom or you're looking outside at a flagpole and you start to notice that these straight lines don't look quite so straight, that's a reason to go and see an eye doctor immediately, because macular degeneration, and particularly wet macular degeneration, is something that if caught early, if treated early, can really help to preserve and save your vision.
How is wet AMD treated?
So wet macular degeneration is treated with an injection of medication inside the eye. And this medication can be given anywhere from once every month to sometimes every 2, 3, or even 4 months. The most recently approved medication is a medication called Vabysmo. But as with every medication or treatment, we always recommend that you talk to your doctor, to your eye doctor in particular, about what the right medication and treatment option is for you.
And it slows down the progression of wet AMD? Can it completely get rid of it?
So you can't get rid of it entirely. And that's part of the reason that you need to continue these medications, that you can't just give it once. I always tell my patients, this is unlikely to be a one and done. You will have to have an injection. And just like taking medication for your high blood pressure or for your heart, it's something we're going to have to do regularly for a long time. But the medications can really help to preserve your vision and maintain good vision.
Well, is there anything that we can do to prevent it?
Well, some things we can't avoid. So as you mentioned, it's age-related macular degeneration, and it's more common in people over the age of 60. So we can't do anything about that. And it is more common in women. But it's also, some risk factors include things like smoking or high blood pressure or even being overweight. And so in those cases, those are modifiable risk factors. Those are things we can change. And so as much as you can, if you can stop or avoid cigarette smoke, that's great. Eating lots of green leafy vegetables is helpful. And then finally, making sure that you're seeing your eye doctor every year, especially if you're over the age of 60, and that if you're noticing, or if someone you take care of is noticing, that their vision is changing in any of the ways I described or in anything else, you really want to make sure you see your eye doctor immediately. Because again, early detection and treatment can be very helpful in this disease.
I'll tell you what, we really do have to be on top of things as we age.
Yeah, it's true. I know you got to see your dentist and your eye doctor. It's a lot to do, but honestly, it really is so important.
Indeed. Your vision is very important. So guys, don't forget to see your ophthalmologist every year at the very least. And like the doctor said, you have to be sure that if you notice any changes at all in your vision, anything at all, get to the doctor, because there are options if caught early. Where can we go, Dr. Kaden, for more information?
Sure. So if you're interested in more information about the medication I mentioned, you can go to vabysmo.com. If you want to learn more about macular degeneration and the symptoms and treatments, I always recommend the American Academy of Ophthalmology, or AAO.org, or the American Society of Retina Specialists, ASRS.org. Both of these are wonderful websites. They have a lot of great resources. They even have things you can print out and share with your family, and they give you more information about the disease and symptoms and treatments.
Dr. Talia Kaden has been my guest. She's an ophthalmologist at Manhattan Eye, Ear, and Throat Hospital. We've been talking about age-related macular degeneration and wet AMD. It can be stopped or slowed if caught early enough. Take charge of your eye health and check with your ophthalmologist and/or healthcare provider. Thank you so much for joining me.
Thanks for having me.